overview of the systematic review that we wrote on the presence of associated injuries in pediatric radial neck fractures. It was published in Children and is available open access via the website. Radial neck fractures in children have been evaluated and treated for almost a century. However, the criteria for treatment choice remain a topic of debate. Numerous studies have reviewed the acceptable angulation of the radial neck and the related threshold for surgical intervention. To date, it is still uncertain how the choice of treatment in pediatric radial neck fractures should be altered if there are concomitant injuries of the soft tissue or fractures around the affected elbow. Case series and even reviews that have included associated injuries in their analysis report miscellaneous effect of associated injuries on the long-term outcome of pediatric radial neck fracture. In our clinic, late sequelae of these injuries are frequently seen. Therefore, a Prisma-guided systematic search was performed for case series that published individual data of children that had a radial neck fracture. Eventually, 20 case series could be extracted and used for data analysis. Individual data of 371 children was extracted and included for analysis. The associated injury incidence was around 1/3 in the whole group, regardless of Judet grade or patient age under or over 10 years. The most frequently found injuries were olecranon fractures or elbow dislocations, in which older children were affected more frequently. Traditional classifications do not involve associated injuries. There's a confusing overlap between them regarding fracture angulation and the grade that is scored. For example, an O'Brien grade 1 could be a Judet grade 2, or a O grade 2 may be a Judet grade 3 or O'Brien grade 2. Mason classification also involves intra-articular fractures. Less frequently used classifications like the Chambers or Jeffrey classifications may therefore be of more use to predict associated injuries. Potentially, it may be beneficial to deduce a trauma mechanism to predict potential associated injury. Most of the pediatric radial neck fractures are caused following a fall on the outstretched hand and a valgus maneuver in which the annular ligament may act as a fulcrum, avulsing the MCL, and in hyperextension or valgus impaction there may be an associated olecranon fracture. Thereby, in literature, there are several authors that also show that supination may be an extra force to cause a medial epicondyle fracture due to pronator teres pull. The main take-home message of this paper is therefore beware of associated injuries, regardless of radial neck angulation or patient age. Thank you for your attention and your interest in our research.